This is ATI Chapter 2, Maternal Newborn, Infertility. Infertility is defined as an inability to conceive or sustain a viable pregnancy. Infertile is an inability of a couple to conceive despite engaging in unprotected sexual intercourse for at least 12 months. Subfertility is the potential of a couple to conceive with additional assistance. Common factors associated with infertility can include decreased sperm production, endometriosis, ovulation disorders, and tubal occlusions. Partners who experience infertility can experience stress related to physical inability to conceive, expense, the effect on the couple's relationship, and lack of family support. Infertility assessments, diagnostic procedures, assisted reproductive technologies, and genetic counseling may be undertaken. Assessment. During an initial fertility counseling session, the nurse should conduct a thorough history from both partners to identify potential causes of subfertility and provide education. Diagnostic procedures. Pelvic examination. Assesses for uterine or vaginal anomalies. Hormone analysis. Evaluates hypothalamic pituitary ovarian axis to include blood prolactin, estradiol, progesterone, and thyroid hormone levels. Postcoital test evaluates coital technique and mucus secretions. Ultrasonography, a transvaginal or abdominal ultrasound procedure performed to visualize reproductive organs. Hysterosalpingography, outpatient radiological procedure in which dye is used to assess the patency of the fallopian tubes. Assess for history of allergies to iodine and seafood prior to beginning the procedure. Contrast media or iodine may not always be contraindication in clients who have selfish allergy. Further assessment may be needed. Hysteroscopy is a radiographic procedure in which the uterus is examined for defect, distortion, or scar tissue that can impair successful impregnation. Laparoscopy, a procedure in which the gas insufflation under general anesthesia is used to observe internal organs. Semen analysis. In 40% of couples who are infertile, inability to conceive is due to male infertility. This test is the first in an infertility workup because it is less expensive and less invasive than female infertility testing. It can need to be repeated. Ultrasonography. An ultrasound procedure is performed to visualize testes and abnormalities in the scrotum. A transrectal ultrasound is performed to assess the ejaculatory ducts, seminal vesicles, and vas deferens. Patient-centered care, therapeutic procedures. Non-medical lifestyle changes and alternative measures. These are nutritional and dietary changes, exercise, yoga, and stress management, herbal medications, acupuncture, and avoid high scrotal temperatures. Medical therapy. Ovarian stimulation. Medications are prescribed to stimulate the ovary to produce follicles. Clomiphene citrate and letrozole. Other medications used to support ovulation is metformin. Other medications to stimulate the endometrium is exogenous progesterone, and appropriate antimicrobial medications for pre-existing infections. Assisted reproductive technologies, intrauterine insemination. This is a procedure used to place prepared sperm into the uterus at the time of ovulation. In vitro fertilization, embryo transfer. Procedure of collecting the client's eggs from the ovaries, fertilizing the eggs in the lab with sperm, and transferring the embryo to the uterus. Gamete intrafallopian transfer. The oocytes are retrieved and immediately placed with prepared motile sperm. Both are placed together into a thin, flexible tube or catheter. The gametes are then injected into the fallopian tubes using a surgical procedure called laparoscopy. Donor oocyte. Donated eggs are collected from a donor by an IVF procedure. The eggs are inseminated. The embryos are placed in the recipient's uterus. Prior to implantation, the recipient undergoes hormonal therapy to prepare the uterus. Donor embryo adoption. Donated embryo is placed in the recipient's uterus, which is hormonally prepared. Gestational carrier or embryo host. A couple completes the process of IVF with the embryo placed in another person who will carry the pregnancy. This is a contract agreement with the carrier having no genetic investment with the embryo. Surrogate. A person is inseminated with semen and carries a fetus until birth. Therapeutic donor insemination. Donor sperm is used to inseminate a person. Nursing interventions. Encourage couples to express and discuss their feelings and recognize infertility as a major life stressor. Assist the couple to consider options and provide education to assist in decision making. Explain role of genetic counselor, reproductive specialists, and providing psychosocial and medical care. Monitor for adverse effects associated with medications to treat infertility. Advise that the use of medications to treat female infertility can increase the risk of multiple births by more than 25%. Provide information regarding assistive reproductive therapies. Make referrals to grief and infertility support groups. Genetic counseling. Genetic counseling may be recommended by the provider if there is a family history of birth defects. Identify clients who are in need of genetic counseling, such as client who are sickle cell trait or sickle cell anemia, or a client older than 35. Make referrals to genetic specialists as necessary. Prenatal assessments of genetic disorders or amniocentesis can pose potential risks to the fetus. Provide and clarify information pertaining to the risk or the occurrence of genetic disorders within a family preceding, during, and following a genetic counseling session. Nursing actions. Assist in the construction of family medical histories of several generations. Provide emotional support. Client responses vary and include denial, anger, grief, guilt, and self-blame. Complications. Ectopic pregnancy. This is where the ovum implants into the fallopian tubes or abdominal cavity due to the presence of endometrial tissue. As ovum increases in size, fallopian tube can rupture and extensive bleeding occurs, resulting in surgical removal of the damaged tube. If ectopic pregnancy is identified prior to rupture of the tube, surgical removal of the products of conception may be performed, or methotrexate is prescribed to dissolve the pregnancy. Client faces increased risk of reoccurrence of an ectopic pregnancy and infertility. Multiple gestation. Assisted reproductive technology is associated with an increased incidence of multiple gestations. This poses a risk for the client and babies.